Hi, I'm Amanda Olson from IntimateRose.com, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And I'm going to talk to you about breathing and the role that it has on the pelvic floor and why it's so important when you are dealing with issues around pelvic pain. So you have vaginismus, vulvodynia, vestibulodynia, you've had cancer and radiation treatment, or maybe you've undergone a gender affirming surgery or other types of surgery around the pelvis and you have tension and just generalized pain. Oftentimes, people tend to breathe really high in the chest when they have those conditions because you're trying to avoid putting pressure through the abdomen and on the pelvic floor, especially if you've had surgery. It's kind of one of those interesting habits that people adapt in an attempt to preserve the pelvis. And so we start to see kind of a shallow breathing pattern in through the chest. And you may notice that you're starting to get tension around your collarbone, maybe in through your neck and shoulders as a product of using these muscles around the neck and the shoulders to produce that breathing. And what that does is it creates further tension. You can develop some grinding habits in the jaw too that's associated with it. And all of those just produce further strain on the body and makes it harder for you to be able to do the things that you want to do. Because when we're not taking nice, full, easy flow of breath in and out of our bodies, we're not getting the best oxygenation to our muscles, not getting the best circulation into our abdomen and into our pelvis. So that adaptation of that shallow breathing pattern is not something people do on purpose. It's not something you're probably doing consciously, but it's most likely happening. And as soon as you call your attention to your breathing pattern, all of a sudden breathing becomes this very alien, foreign thing that all of a sudden seems very tricky. Another thing that people tend to do when they have ongoing pelvic pain is they tend to hold their breath. So you might notice that you find yourself having to do a deep sigh. You know, if you're really focusing on something or you're really stressed out, you might find yourself kind of doing this kind of deep sigh, breathtaking, and that's often indicative that you've been holding your breath for a while. And your body's saying, hey, oxygen, please, take a breath. And so if you are one to catch yourself doing that, that's probably a habit that you've adapted. And I see that a lot in the clinic, especially when people are trying to relearn how to breathe, or if they're learning a new skill, like how to relax the pelvic floor muscles, or maybe going through a new type of stretch, or maybe in the anticipation of pain, whether it's during an exercise in the clinic, or sometimes people will report it when they go to try to have sex or to engage in some new type of activity, that they hold their breath. And breath holding creates more tension too. It can put more pressure through the pelvic floor, and it can serve as kind of a reinforcement of these kind of gripping, clenching habits that happen in through the pelvic floor muscles. And again, not something that you're doing on purpose if you catch yourself doing it, but just something that tends to happen. So the reason why the pelvic floor and breathing are associated is because whereas the pelvic floor is the floor, the diaphragm is the ceiling of the thorax, so your trunk. And when we breathe in, the diaphragm pulls down to bring that oxygen in to the lungs. And in doing so, we get a little bit of a drop in the pelvic floor. So it kind of works like a piston. If you're familiar with mechanics, or if you know anything about cars and how pistons work, as we inhale, the diaphragm drops down, pelvic floor should too. So we should have a little bit of range of motion of those muscles. And then when we exhale, the diaphragm lifts up, and so does the pelvic floor. So for instance, in people that are experiencing weakness of the pelvic floor muscles, we always cue them to do that Kegel, do that contraction on the exhale, because we get a nice lift. What that lift does with the diaphragm lifts the weight of the intestines and the bladder and the bowel up a little bit and allows the pelvic floor to have a nice range to pull up against. People that are experiencing pelvic pain and muscular tension and tightness around the vagina and around the rectum and sometimes around the urethra of the bladder, we want to cue you to be practicing relaxation and even learning how to drop down and bear down slightly into that pelvic floor on the inhale. So we're just maximizing this natural mechanics that our body has to create that nice piston-like flow. So the first step in learning how to breathe in a more physiologically beneficial way is to lay down on your back. You can bend your knees and plant your feet if that feels better on your low back. You can put a little bolster in there or a sleeping bag underneath your knees to decrease the strain on your back, or you can lay flat if that feels comfortable to you too. But you're going to place one hand on your chest and one hand on your belly. And you're going to have the goal being to keep the hand on your chest very still. And you're going to have a goal of breathing up and into the hand on your belly, almost like it's a balloon. So if you're laying down and here's your belly, you want to think about inhaling and gently allowing the abdomen to rise and exhaling and gently allowing it to fall back down. So we're not forcing the exhale. We're not trying to push the oxygen out. Just a nice, easy inhale, dome up through your belly. Exhale, let it come back down. Again, when you draw your attention to your breathing pattern, oftentimes it can feel very odd. You might find that there's a stutter in how the belly comes up because your brain may have adapted this fear that's not out of a trained response, but more of a deep-rooted need to protect you, to breathe away from your pelvis and away from your belly, especially if you've had surgery on your ovaries or on your uterus, where some of those laparoscopic portals, your little scars, are in your belly and they were a little tender when you came out of surgery, or if you've had an appendix removal. And so what we need to understand is that after 6 to 8 weeks, that tissue is healed. There could still be some scar tissue in there. And if you are experiencing tightness and puckering of that scar, seeing a pelvic health physical therapist is really beneficial to soften that scar tissue and get better mobility. But in the meanwhile, learning how to breathe through that belly will help get some better elasticity in through the abdomen and gonna get you better circulation throughout. Also, learning how to use that breath is going to be very beneficial if you are, say, moving on to try to do some more work with vaginal dilators, if you're experiencing constriction around the vagina, or maybe some trigger point release if you have tightness in through the pelvic floor. So breathing being one of the cornerstones of learning how to reduce tension on your pelvic floor. For more information on pelvic pain, visit our website at intimaterose.com. And with any questions you have, feel free to email us at support@intimaterose.com.